Hello, Dr. Philippe. How are you?
Fine, thanks, and you, Akram?
I'm doing good. This is Quick Talks in the IDS.
Yeah.
And I've asked so many people, like, this is the first time. Is it your first time also?
No, I already been there before.
You've already been there. Okay,
Yeah.
the first one. Okay. Why do you come to the IDS, for example? Like, why do you, what benefit does it give to you?
For me, I think as a clinician and a researcher, it is really relevant to follow what are the new trends in dentistry, and what we can see at the IDS every time will be the future of our practice, and we really see trends that are going to emerge.
I see. And I I heard your lecture yesterday, and we had a little bit of discussion even before that. You're into digital dentistry
Yeah.
and polymers, also like you talked about polymers. So, can you share this information with the people who are listening? Like, why do polymers interest you?
Well, I think the people who are hearing to us already know that, but polymers have changed the dentistry. By bonding, we are able to make less aggressive treatment for the patient, to preserve more tooth structures, and this is totally linked to digital, because with digital dentistry, it is easier for practitioners to find a new way and applying minimal invasive treatment to the patient and reduce the number of appointments. For me, everything is totally linked. Minimal invasive dentistry and reduction of number of appointments and accuracy and reproducible results.
I see. Minimal intervention dentistry, MI dentistry, like looks to be a very popular concept, especially in Europe. Uh, why is that? It makes sense, but obviously for everyone, but in your opinion, why do you prefer to have an MI approach in your treatment?
Well, what I love saying to the patient is that I expect for them that they won't die with my treatment. And
Yeah.
I really hope that I will be able to make again and again the treatment, because I think we can't treat the patient for 80 years. Of course, we have to change what we've done in their mouth, because everything age, and of course, at the moment has to be replaced. And if we look to the cycle of life of a tooth, we know that a tooth that had an intervention will have other intervention, and
Yeah.
the most minimal we are in the approach, the most important number of intervention we can do before losing the tooth.
I see. Also, in the lecture, you talked about direct and indirect dentistry. How do you incorporate, direct and indirect dentistry in your job? For example, we just talked digital dentistry is also right now kind of revolutionizing, dentistry. To be honest, right? What's your process like? First of all, preference, which might be, something that is personal for everyone.
Well,
Yeah.
it's offer you the opportunity to adapt your treatment to the patient. For example, if your patient is suffering from a small decay, of course you will do direct restoration. Of course, direct restoration has a lot of indication. But if you need, for example, cusp replacement of a tooth to make a partial restoration, at this point, it's no longer possible to make it easily and reproducible in my hands with a direct restoration. So I can propose the patient indirect restoration at this time. And for me, it's really the same. Moreover, there are many treatments where at the beginning of the treatment, you are not able to say to the patient, I will go direct or I will go indirect. And I said to him, okay, you have two options. And if I can make direct for reducing the cost and of course also reducing the loss of tissue, we will do direct. And if during the treatment we need indirect, that's not a problem. I have my intraoral scanner, I have my milling machine, so I can make the treatment indirect. So it's really a way of adapting. And you have to adapt to each situation. There is another example, is that with indirect, with milling machine, with printing, with intraoral scanner, you never feel lost during the treatment. It can happen that a treatment is a little bit difficult, or you things that you doesn't imagine happen. And
In which one?
during the treatment, sometimes there are things that
Yeah, that's the thing.
sometimes things happen.
Yeah.
And with all of our equipment, we are able now to cover all the possible situation. Even if my lab technician need to give me help, for example, I send it the file, he make what I expect from him, I print, I put on the patient. It's like
It's more
often
predictable.
Sorry?
It's more predictable. It gives you more predictable results.
Yeah, it's for me. It's of course it's more predictable, but it's also that your lab technician is with you, even if he's 300 kilometers away from you. With digital, he is with you, and he can help you in many treatments.
Exactly. I just met I was just talking to a dentist here in Europe that has his cases sent from Japan. He scans them, he gets everything done, and then obviously the scan is online, so the cloud is in the cloud, and then they make the procedure and they send them back to Europe.
Yeah.
So it's kind of like honestly.
Your technician can be everywhere now.
Anyway, it doesn't really
yeah.
matter, right? Yeah, nice. Also, something that we discussed, or what you discussed, was 3D printing, for example.
Yeah.
How do you see the future of dentistry and having 3D printing in it?
I'm pretty sure that 3D printing will be a bigger revolution for the dentist than the milling. It's sure about that. Actually, the quality of printing is a little bit lower than the quality you can obtain with milling, but the price is not the same, and printing is more affordable for a dentist. Moreover, at the era of digital, when you've got your intraoral scanner, there is a thing that is missing. You miss the physical part of, for example, your intraoral impression.
Yeah.
And just with a click, with 10 minutes, you can have the physical print of your patient teeth. So for me, it's really a thing that is totally linked to intraoral scanner, and that offer you many possibilities in your treatment if you need.
I see. Something in the end, if there is one point that you would like people to keep in mind that you were, listening to this podcast or in your lectures, people who attend your lectures, what would you like to ask them to keep in mind?
I don't know. I think we had we had together many good moments recently, and I think the message is just to have fun in our practice, and of course we are there to heal the patient, but we are also there to have fun and not to do every day the same work. And I think it's really what manufacturers like GC offers to us.
You mentioned something about being able to have fun, which is switching up your work.
Yeah.
So you work at the university, right? So you do one day in the clinic, one day do research and something like that. So maybe our listeners could actually do something very similar, but that fits to their lifestyle, right?
Yeah.
Yeah. Anyways, thank you very much for being on the
Thank
podcast.
you, Akram.
Appreciate you very much.
It's been a pleasure.
Thank you.